you have at the moment, you can put them into chat and they'll be answered in real time. Really what we're doing is we're looking at an overview of the application of the Buteyko technique and just breaking it down a little bit in terms of applying it to different health modalities. And my own background is that I've been teaching the technique for about 23 years plus. I've written 11 books, and specifically for respiratory health, for sleep health, for mental health, and also then working with children. Before we start, I'm always curious to kind of get an idea of where people are coming in from. So I'm just going to put the view to the gallery for the moment, and even just 3 or 4 names. So if Susan Robson doesn't mind saying where is she coming in from, what does she do?
Yes, I'm Susan, as you said. I come from Tynemouth, which is near Newcastle in the northeast of England.
Great. Thank you, Susan. And what do you do?
I'm retired now, but I used to be a social worker in cancer
Great.
services.
Great, great. Thank you. Anne Power, where are you coming in from? What do you do? Sorry, you'll have to unmute yourself.
Hello, good afternoon, Patrick, everyone. Hi, I'm Anne from London. I've been practicing Buteyko since about 2012. I've been in contact with Buteyko International recently because I'm doing quite a bit of work in London. So I'm excited to be on this particular event as well, to know how in my practice I can incorporate it more as well. So I'm a massage therapist, reflexologist, and I do quite a lot around breathing as well. So
Great, great stuff, Anne.
thank you.
Super. Michael, where are you coming in from? What do you do? Sorry, there, you've muted yourself back again.
I guess this is me, right?
That's you.
Yeah. Okay, so I'm from Poland, and yes, I work as a breathwork instructor. So I started my journey with practicing Wim Hof method. Then I trained under John Paul Creamy, and that was conscious connected breathing. And then I decided to train with you, and I became an oxygen
Okay.
advanced instructor. So here I
Great.
am to also listen a little bit about Buteyko.
Great. Great stuff, Michael. And then Michael with the white t-shirt, where are you coming in from and what do you do? Sorry, you're muted. You're muted again. Yeah. We
Hi,
should
there
hear
we
you now.
go. Yeah, I'm from the Isle of Man. I'm actually in Horwich Bolton at the minute, in my second home. I've been following your work for about 5 years, and a couple of weeks ago, I've just signed up to your Oxygen Advantage course, so I'm hoping to learn a lot more. I was a sports coach, a judo coach, and you knew I was breathing wrong all along from your work that I've seen since. I also ended up quite well as well with ME, chronic fatigue syndrome, and I've been using your well, basically from watching your videos, I've been teaching myself how to get through that.
Yeah.
I'm not. I can't say I'm cured, but my baseline health has improved so much that I'm able to do things like this now. So
Great stuff.
yeah,
Great.
looking forward to meeting you on the live Zooms and your course soon in September, I believe.
Great, Michael. And just one more person, Nadja. Where are you coming in from? What do you do?
Oh, hi. I'm Nadia. I come from Serbia, and I am a film and TV production manager. It was my first job. Then I changed the career, let's say, and I'm working as a ski instructor and a manager of a ski school. We work with kids a lot and also a bit involved in Paralympic movement. And I plan to finish few courses about breathing and incorporate that with the things I do right now. So I'm gonna do your course and maybe Buteyko Clinic course in November. So that's it for now.
Great. Interestingly, I just did a podcast with an individual called Marcel Hug.
Okay.
So he's probably one of the most famous Paralympian of all times. He's 8 gold medals. And he has been applying the oxygen advantage in his training. And I met him in Switzerland and at our training. So that podcast will be live probably in the next couple of weeks. I think that will be an interesting one for you to watch, given the nature of your work.
Yeah,
Thanks
thank
very
you.
much. Thanks, Naja. Thanks very much, everybody. I'm going to kick off. As I said, Ruth Gibney is here. Owen Tunge is here. Any questions that you have, you can post them directly into the chat. They will help answer them in real time. And then the way it's going to work is I want to kind of go through breathing and to give you an overview of breathing for the application of health, how it could be integrated into what you're already doing, different options. We will go through some breathing exercises. Breathing can be confusing for some people. You know, sometimes I feel there's a great misunderstanding about what constitutes breathing and functional breathing. And we will do some breathing exercise, and I'll tell you the ones that really kind of got me into breathing. And then the last half hour will be for questions and answers. So any questions that you have, I'll try and answer. So we'll be on for the next hour and 25 minutes or so. We'll kind of stop in around 7:30 London time. So I'm going to start off with a PowerPoint presentation. And again, it's really, this one here is going to be tailored to people who are working in healthcare, such as yourselves. A little bit of background information. I did come across the Buteyko technique back in the late 1990s for asthma. Having asthma, stuffy nose, and you never just have asthma and a stuffy nose. You're also more likely to have a sleep problem. I was tired, my concentration wasn't great. And that's kind of normal, you know, because breathing is that function. If breathing is off, it's not just isolated to respiration. If your breathing is off, your state of mind is off. If your state of mind is off, your sleep is off. If your breathing is off, your sleep is off. And if your sleep is off, your state of mind is off. So it's a very, very important function. I started breathing less air. I never realized that by breathing less air that it would improve my circulation, which it did. I always had cold hands and feet, and it's not just the circulation in your hands that you improve by changing your breathing patterns. It's also blood flow to the brain. There's a huge amount of information now coming out, even looking at, say, the likes of the default mode network, rumination of the mind. And oftentimes people talk about directing their attention somewhere, doing mindfulness. But what if you have dysfunctional breathing patterns and poor sleep? And that's what's feeding into rumination of the mind. So you can help to quieten the rumination by improving blood flow. And even just by nasal breathing, there's a massive difference between nose breathing versus mouth breathing. And the science is there as well. You know, if you were to do some research on it, if you breathe through your nose, does it have a different effect on the default mode network versus if you breathe through your mouth? So always think that mouth breathing is more of an increase of a stress response and will contribute to, say, for example, brain fog or rumination. And it's not good to be mouth breathing during sleep. I trained in Moscow back in 2002, and I was accredited by the late Dr. Konstantin Buteyko. We have put up, you can see my diploma there. And I'm a regular speaker. This is my full-time occupation. I've worked with thousands of clients, and I've written 12 books. And my most recent book is just about to be published in the next week or two. I have copies of it here. So we have several thousand healthcare professionals after going through our training. So we're one of the biggest, we are the biggest Buteyko school in the world. So we hope to be able to impart that experience to you. What about dysfunctional breathing, and why does it matter? Breathing often gets overlooked, and you might be working with your clients and your clients' breathing are under par, but how do you assess it? How might you know if your client's breathing is under par? So when you think about breathing, there's a number of different dimensions to it. You know, is the person breathing high in the upper chest versus having good recruitment of the diaphragm? Or do they have hyperventilation syndrome, chronic hyperventilation syndrome? Are they a mouth breather? Do they have irregular breathing patterns? Are they breathing faster? Are they breathing harder? So all of those factors would feed into dysfunctional breathing. And the literature shows that 90% of athletes have some form of dysfunctional breathing. That's measured from a biomechanical point of view. And listening to Michael earlier on, he was saying that he was coach at a high level with sports, but also having poor breathing. And the thing, even with athletes, if they have poor breathing, they can be overtaxing their system. And it's not good, because whenever you think about recovery, And you want to push the boundaries, but you don't want to overdo it either, because that then can rebound on you. 75% of people with anxiety or panic disorders have dysfunctional breathing patterns. And that's a really interesting one, because you could argue that people with anxiety, they are breathing faster and harder in upper chest, and they feel that they're not getting enough air, and that's because of their anxiety. But we have to ask the question, what is that everyday breathing pattern doing to their anxiety? You know, there is a way to breathe to tell the brain that we are safe, but there's also a way to breathe to tell the brain that we're under threat. And it's not just the bottom-up communication. It's not just the feedback from the lungs, from the breathing system up to the brain. The brain itself is spying on breathing. And if you Google Stanford and slow breathing, so Stanford Medical and slow breathing, you will find that in 2017, they identified a structure in the brain in the pre-Buteyko complex, which is literally spying on your breath. So you have the brain spying on your breathing all of the time. And it's that information that the brain weighs up whether you are safe or whether you are under threat. And the most important function of the brain is to ensure survival of the body. So a lot of people will be telling their brain that they're under threat, and they're doing that via their breathing patterns, because dysfunctional breathing is common, unfortunately, and it often gets overlooked. And the misinformation may be then this person with anxiety goes to their counselor or goes to their coach, and the coach tells them, oh, you're feeling stressed, take a few deep breaths. And that could be absolutely the worst thing that that person could do, because how are they doing that breath? Is it a deep breath or is it a big breath? And the big question is that breathing practice helping their underlying breathing? You know, if somebody has dysfunctional breathing, we need to target the dysfunctional breathing. And breathing is a number of different dimensions, which we'll go through. 50% of people with sleep issues are breathing through an open mouth during sleep, and that's not ideal. And any of you, just even for yourselves, if you're waking up with a dry mouth in the morning, you're not likely to wake up feeling refreshed. You're more likely to have lighter sleep. You're more likely to wake up during the middle of the night, and you're more likely to wake up feeling tired. So mouth breathing does impact snoring, and it does also impact obstructive sleep apnea, and not just mild. It's also known that people with severe obstructive sleep apnea, those individuals who are mouth breathing, they tend to have lower oxygen desaturation and higher apnea-hypopnea index. Even with children, you know, this was taken directly from a paper by Karen Bonnock, and it's published in the journal Pediatrics in 2012. And she looked at 11,049 kids in the United Kingdom in Stratford-upon-Avon. And the quotation direct from the paper is that a history of sleep disorder breathing at age 5, it was associated with an almost 40% increased risk of special education needs at age 8. And the reason being is because she's saying that if children are having, say, the classic hallmark symptoms of sleep disorder breathing, which will be mouth breathing or stopping breathing or snoring, you should never hear a child breathe during sleep. The child shouldn't be mouth breathing during sleep, and the child certainly shouldn't be snoring during sleep or stopping breathing during sleep. And if the child is having a history of sleep disorder breathing, if it's untreated at age 5, what it means is that that child is not getting adequate deep sleep, and brain development takes place in deep sleep. So when we talk about sleep, there's different stages of sleep, and you do need to get down to stage 3 sleep or entry sleep, and that's when the brain develops. So poor sleep is really impacting children, but of course it impacts adults as well, because poor sleep quality, and you could have 10 hours of sleep, but it doesn't mean that you've got good sleep quality. The brain cleans itself during sleep. And if an individual is having sleep fragmentation and disrupted sleep, it can increase the risk of dementia, etc., later in life. And the other thing about sleep is mental health. I will always say that if somebody comes in and they have anxiety and panic disorder, or if they have depression, their sleep is always likely to be impacted. And you could ask the question, is it their mental health issues that are causing their dysfunctional or poor sleep? Or is it their poor sleep quality, which is causing their mental health issues? And very often sleep gets overlooked, but not just sleep, of course, breathing gets overlooked. So, you know, the most important functions of health are impacted by how you breathe. And the literature is there of You know, if you wanted to kind of get a deep dive into it, I have a book called The Breathing Cure. I didn't choose the title of it. That was the US publisher. But it's a scientifically written book. In other words, referencing, I think there's about 700 or 800 references to the application of breathing in terms of self-regulation and the nervous system. We don't want to be in a total chronic stress with increased activation of the stress response, because that catches up with us. Our respiratory health. The Buteyko technique was popularly used for helping people with asthma. There's 20 clinical trials. And I always said to my students coming in with asthma, I would expect your symptoms to be reduced by 50% in 2 weeks. And that wasn't an exaggerated claim. I always told them that. You put this into practice. You change your breathing patterns. Start breathing in and out through the nose. I'll give you techniques to help decongest your nose. You help open up your airways, and your symptoms of coughing, wheezing, breathlessness, and chest tightness, and even recurrent colds and chest infections significantly reduce. And with that, then you have better asthma control. And then with your GP, with your doctor, your need for medication can be assessed. Many asthmatics are breathing with an open mouth, and they breathe that way because they feel they're not getting enough air. And of course, that feeds into their condition. And it's not just open mouth breathing that's impacting asthma. It's how fast and how hard are they breathing. Sleep apnea, snoring, and also sleep and recovery here, we can make quite a significant impact. As I said earlier on, if you have your mouth open, it's a red flag. But also if you're breathing hard and fast, there's an increased negative pressure in the airway. And if you're sucking more air into your lungs and you're breathing hard and fast, you can contribute to causing the upper airways, so the throat, to collapse during sleep. And if the throat is partially collapsing or totally collapsing, not enough air is getting into the lungs. And as a result, not enough oxygen is getting into the blood. And your oxygen levels drop then during sleep. And the brain, of course, senses this and takes you out of deep sleep to force you to resume breathing. But then you have sleep fragmentation. Massive problem, poor sleep. 30% of people have insomnia. That's due to hyperarousal. Not, with everybody, but how hyperarousal, increased stress response, is a central feature of people with insomnia. About 10 to 20, well, it's probably more, 40% of people with snoring, depending on age. And obstructive sleep apnea is estimated to affect 936 million people on the planet. So between 25 to 50% of people obstructive sleep apnea. But the problem with sleep apnea is that most people don't get diagnosed. 85% are not diagnosed. Children's development, we spoke about that, mouth breathing and upper chest breathing, and even feeding into the likes of ADD and ADHD has a big role to play there. So child, to do well academically, need to be able to sleep well. If they sleep well, it absolutely helps with their academic achievement. But the opposite also holds true. If they don't sleep well, their academic achievement is going to be impacted. And they really do have an increased risk of learning difficulties because of the poor sleep quality, and your breathing plays a role there. And of course, physical movement as well. How do you breathe? Are you overly breathless during exercise? Feeling overly breathless during exercise isn't just a fitness issue. That can be a breathing issue. And if you want to reduce your breathlessness during physical exercise, you're much better off targeting your breathing rather than your fitness. You could actually improve your breathing by sitting on the couch. And when your breathing is better, then you do your physical exercise. Because if you can target the very thing that's causing breathlessness, well, that's your breathing system. That's what we should be targeting. Because, you could do all the physical training in the world. It doesn't mean that you're going to have good breathing patterns. So I'd like to make a massive point that not all breathing exercises are the same. There's a huge differentiation between one and the other. So one exercise may help one person, but won't help another person. And it's very important to know who's in front of you. What is their underlying breathing pattern? Can you assess it? And also then, can you tailor breathing exercises according to that person? If you're working with somebody with asthma, it's very different to somebody with panic disorder. And it's important to take that into consideration. So those are the four main themes, the four main pillars in terms of respiratory health and sleep health. And I will go through, in a little bit depth, especially with the exercise as well. So if you work with any of the conditions below, the Buteyko method is helpful. And again, the three main pillars are, but high blood pressure is also a factor because, say, for example, The Buteyko technique was actually discovered for helping high blood pressure because Dr. Konstantin Buteyko himself had high blood pressure. So persons with high blood pressure could have poor sleep, but also high stress levels. And the autonomic nervous system is in an increased stress response. But breathing is a very direct route into dampening the stress response and increasing relaxation. But how do you do that? And it's not just about slow breathing, because slow breathing can have a paradoxical effect. You could say to somebody, breathe in for 4 seconds and out for 6, or breathe in for 5 seconds and out for 5. But is that person able to do it? Say, for example, you have somebody who's highly stressed or they have anxiety and their breathing rate is 20 breaths per minute. And then if you bring them from 20 breaths down to 6 breaths per minute, they will likely overbreathe because there's something that's driving their breathing to 20 breaths per minute. What's causing them to breathe so fast? And if you just ask them to start slowing down your breathing to 6 breaths per minute, that's not likely to change their breathing patterns because it's not targeting the drivers to breathe. So that's why it's important, and in terms of breathing, when we take a breath in, so the back part of the brain here, the brain stem, which it connects the brain to the spinal cord, it's a very primitive part of the brain. And within that then are central chemoreceptors, or part of that brain is monitoring your carbon dioxide. So the primary driver to breathe is carbon dioxide. And as the gas carbon dioxide increases, and this gas we produce internally in the body, but as the gas carbon dioxide increases, blood pH drops, and the brain sends a signal to the diaphragm breathing muscle, and the diaphragm breathing muscle moves down by about 2 to 3 centimeters. And that in turn then creates a negative pressure in the chest to draw air into the lungs. So it's not the air coming into the lungs that pushes the diaphragm downwards. It's the movement of the diaphragm downwards that increases the volume of the chest cavity. And that in turn then creates a suction pressure, which draws air into the lungs. So it is good to breathe in and out through the nose, and definitely not in and out through the mouth, because nose will have a better recruitment of the diaphragm, whereas mouth is more upper chest. Nose will typically slow down breathing. Nose will harness nasal nitric oxide. With nasal breathing, you also have a lot of communication via the olfactory nerve from the nose to the brain, and you don't have that with mouth breathing. So breathing in and out through the nose also influences memory and concentration and attention. Stress levels are influenced by nasal breathing versus mouth breathing. Brain fog is influenced by nasal breathing versus mouth breathing. Sleep is influenced by nasal breathing versus mouth breathing. Your dental health. So if you have a child or adult and they're going around with their mouth open and they're breathing cold, dry, unfiltered air into their mouth will tend to dry out. So there's a reduction of saliva, and saliva protects our teeth. So saliva is very, very important for the microbiome in the mouth. And a dry mouth, that individual is more prone to dental cavities and gum disease and bad breath. So I had a podcast yesterday or the day before with Dr. Mark Barhenny, and he's from askthedentist.com. He's quite well known. He's about 700,000 followers. And just a conversation come up. Oral health, is that primarily from brushing your teeth, or is that from how you breathe? And his conclusion was it's from how you breathe. So you could have a child or adult who is brushing their teeth frequently, not eating so many sweets, and yet have dental cavities. And unfortunately, mouth breathing gets overlooked, because you never see a poster in a dentist surgery to encourage patients coming in to close their mouth. But yet, dental health is going to be influenced by how you breathe. So dysfunctional breathing is multidimensional, and I will show you a technique to decongest the nose and also to breathe less air. So the biochemical dimension of breathing is very important. This focuses on normalizing carbon dioxide and also reducing the sensitivity to carbon dioxide. So as I mentioned earlier on, carbon dioxide is the primary driver to breathe. Every breath that you take is primarily driven by carbon dioxide. But some people are overly sensitive to the accumulation of carbon dioxide. And what that means is that they will have faster breathing and harder breathing, and they will feel that they are not getting enough air. And they breathe that way during sleep, of course, as well. And if you're breathing harder and faster during sleep, you have greater turbulence. But if you do physical exercise, you breathe faster and harder, you're more likely to be breathless. So the biochemical dimension gets overlooked, and that's really where Buteyko stands out a mile, because the focus is very much on the biochemical. But also the focus with Buteyko in comparison to any technique that I've been aware of is nasal breathing. the whole emphasis on nose breathing 24/7. Of course, there's a time when you're talking, you're going to have your mouth open, you're going to be breathing through it. When you really ramp up physical exercise, you're likely to breathe through an open mouth. But we would even say with people doing recreational physical exercise, do your best to maintain nasal breathing. There is a massive difference in terms of the health benefits when you breathe through your nose during physical exercise versus when you breathe through your mouth. So if you're breathing through your nose during physical exercise, you're dilating your blood circulation, you're improving your blood circulation. So you've got a better blood flow throughout the body, including the heart and brain, by doing physical exercise with your mouth closed. So a lot of people do physical exercise to help with mental health. But why not do it with their mouth closed, that they have a better recruitment of the diaphragm, that they're helping with their underlying breathing patterns. They're adding an extra load onto their breathing. They're increasing blood flow and oxygen delivery to the brain. But they're also, by increasing carbon dioxide and lowering blood pH, that it helps to reduce brain cell excitability. So the brain, by regulating breathing, controls its own excitability. And that's just by making changes, you know. This isn't about giving you a breathing practice that you have to lie down on your back for half an hour every day or anything like that. No, it's not. Like, nobody's going to do that indefinitely. Any breathing practice, it has to be accessible. It has to be easy for the person to put into practice. So if you know how your breathing impacts your health and you're aware of that, you can be then making changes throughout your day, paying attention to it. Like if your head is feeling heavy and you've got a lot of thought activity going on and that's fueling your emotions, and of course your breathing is changing in response and feeding back into the heaviness of everything. Well, taking your attention out of your mind and taking a soft, gentle, light breath in through your nose, almost that your breath in is imperceptible, and then allowing a really relaxed and a slow and a gentle breath out. And you don't have to time it, because what may work for one person isn't going to work for another. And that's one issue that I have with timing of the breath. You know, we should always change our breathing relative to how we breathe, not to have one cue that everybody is to follow. And even if you're doing a breathing class, I don't put out there breathe in for 4 seconds and out for 6 seconds. Yes, we can do it and we do it, but only when we have looked at the biochemical dimension, the biomechanical dimension. So the emphasis for me is tailor breathing according to that person, and for the student to really understand, you know, you can improve your blood circulation by targeting the biochemical dimension, but you can also open up your nose. You can help open up your airways. You can help to expose yourself to air hunger, to desensitize your reaction to suffocation, which is oftentimes a feature with people with panic disorder. You can also improve your sleep quality. The biomechanical dimension is focusing on the diaphragm, better gas exchange, better recruitment of the diaphragm, stabilization of the spine, better lymphatic drainage, better massage of the internal organs, and venous return to the heart. So there's a lot going on also with the biomechanical dimension. And then the psychophysiological dimension is focusing on the nervous system, stimulating the vagus nerve, strengthening the baroreflex, dampening the stress response, and increasing relaxation. But also all three dimensions are separate. So this is like going to a gym. And if you have a good strength and conditioning coach, that strength and conditioning coach is going to lead you through one routine to target a specific area, and then another routine to target a specific area, and another routine. And that's what we should be doing about breathing. So I'd like you to give this a go. And this is the control pause, which is from the Buteyko technique. It's also called the boat score in the oxygen advantage. And there's no cameras on you, so no pressure. So whenever you're ready, what I would like you to do is take a normal breath in and out through your nose, and pinch your nose and stop breathing and time it in seconds. How long can you hold your breath for and still have normal breathing when you resume breathing? So how long can you hold your breath for after a normal exhalation? So you have a normal exhalation and your time, how long can you hold your breath for and still have normal breathing when you resume breathing? So the key is the normal breathing when you resume breathing. So I mentioned some occupations there, but this is the application of breathing. People who are already teaching it, such as breathwork facilitators, that you get more tools in your toolbox, meditation, teachers, naturopaths, life health coaches, acupuncturists, doctors, any person, if you're working with an individual and if poor sleep, poor breathing, or stress plays a role, breathing should be part of your toolkit. Because even say, for example, if you're a psychotherapist and you're teaching CBT, cognitive behavioral therapy, but what if your student has dysfunctional breathing? The CBT is not going to address the dysfunctional breathing patterns, but the dysfunctional breathing is going to continue feed into their anxiety and panic disorder. So that's why not teach CBT and teach the Buteyko technique. And the same with yoga, for example. Yoga breathing and yoga instructors, there's massive potential here. And the origins of breathing in yoga was not about taking the full deep breath. That only came into, into kind of awareness, not even awareness, but came into being back in the 1880s. Prior to that, yoga instructors were about conservation of the breath and subtle breathing and breathing less air. So very often in the Western world, we have this emphasis of breathing more air. The more air you breathe, the better. Breathing more air doesn't increase oxygen delivery throughout the body. Breathing more air doesn't improve your blood circulation. Breathing more air doesn't calm you down. Okay, if you want to release trauma, you can do hyperventilation breathing techniques to help with release of emotions. But if you're breathing more air on a day-to-day basis, that's not going to help you in any way or any shape or form. For many of us, we need to be breathing less air. We're already breathing too much air. We're already breathing too fast and too hard. If you look at somebody breathe, how are they breathing? And if you're working with somebody or maybe your family member and you're hearing that person breathe during rest, and if you look at their breathing and you see that their breathing is quite noticeable, and then just ask yourself the question, how does this person perform in their life? How well are they able to cope with stress? How well are they sleeping? So all of these things, and I'm not saying that breathing is a cure-all, absolutely not. But what I am saying is that, is there any other function that is free? And once you learn it, you have it for life, that you literally can improve your blood circulation and open up your airways and increase oxygen delivery and balance the nervous system and improve your sleep. There's no other function. Diet doesn't do that. Physical exercise doesn't do that. Meditation doesn't do that. So that's where breathing really has a role. But the question is, what breathing? So in terms of trainings, there's plenty of options. We have online trainings and we've got a really good training module, online portal. And it's kind of step-by-step with PowerPoints. I'm explaining each PowerPoint. And then there's a little quiz. And I think there's about 18 modules with the online training. It's very detailed. There's client handouts and things like that. And also we have monthly refresher classes. We meet up once a month. And the online training also comes with 5 or 6, maybe even 7 2-hour sessions with myself. So that's in a classroom environment. And the other way then to do it, if you are a healthcare professional or anybody, even if you're just starting breathing for the first, so we don't have a prerequisite. You don't have to come from a healthcare background to start teaching breathing exercise, because it's a very standalone technique. The Buteyko technique is, there's in-house also. And that's the next one. And the only one that's left in 2025 is in Galway in Ireland. So it's in the West Coast, and this is at my studio, but also, so we have a purpose-built training studio, and my house is in a place called Mycullen, County Galway. So it's about 2 hours from Dublin, and it's on from the 27th to the 30th of August. It's 4 days. Food is provided. It's about 35 people maximum, and the cost of it there is 1,350. But you also, it's not just for the 4 days. You have access to the e-learning platform. You've got the ongoing monthly refresher. You've got a lot of different resources, and also got lifetime access to the training materials. And with that as well, you get a copy of a manual that's sent out to you, but also my latest book, which is The Breathing Cure for Sleep. So I'll just finish with this slide here. So this is the online. There is quite a significant reduction in price because it's online. The online is pretty good as well. I would always say face-to-face is better, to be honest with you, because you just have that interaction. There's always something we as human beings, but online is good because everything is the same course. It's just how it is, how it's presented. So you have the 7 by 2 hour Zoom classes here, and you have the monthly refreshers. So there's similarities there. The only difference is you're not getting the 4 full days. You're getting 7 by 2 hour sessions, and you're also getting everything else as well. So that's the end of this PowerPoint. So let's do a bit of practice. because I'm sure some of you are curious. So I'm going to start off with some very gentle breathing exercises if you're feeling stressed. You know, oftentimes people, if they have a lot of mind activity going on, they're maybe encouraged to do mindfulness. And I often have difficulty with that because you know it yourself. If your mind is agitated, the last thing you want to do is pay attention to your breath. If your mind is agitated, the last thing you want to be is mindful. So mindfulness is not going to work with the very person who needs it the most. So here's a small little breath hold exercise to help tell your brain that you're safe. And that's what we want to do. We don't want our breathing telling the brain that we're under threat. Now, you might ask, well, how might our breathing do that? How does your breathing change if you get stressed? So when you get stressed, how does your breathing change? Is it faster or slower? Is it harder or lighter? Is it regular or irregular? Is it mouth or nose? So you will have a fair idea that when you're stressed, your breathing speeds up, you breathe harder, you breathe upper chest. You're breathing probably more mouth breathing, irregular breathing patterns. And of course, that breathing response is going to feed into stress because your brain is continuously weighing up how you breathe. But what if you breathe a little bit like that every day? What if you breathe a little bit faster and a little bit harder? It's not that you're having a panic attack. If the respiratory rate is greater than 15 breaths per minute, it's an indicator of increased brain cell excitability. And if you look at the work of Michael Binder, psychiatrist, and also Dr. Andy Huberman has talked about it, and other people have talked about it, that we have 80 billion brain cells, and each brain cell is communicating with 15,000 other brain cells. And if brain cells are overly excited, that's not a good place to be because it's going to fuel mental health issues. But how can we quieten that excitability? It's not by breathing more air, it's by breathing less. So here's a little exercise to help stimulate the vagus nerve and help to quieten the mind. And you don't have to pay attention to your breathing. So whenever your head feels heavy, hold your breath and hold your breath at the end of an exhalation. Don't take the deep breath that people tell you. The deep breath, it might feel like it's helping you because it alleviates air hunger. But the deep breath is going to get rid of too much carbon dioxide and reduce blood flow to the brain and reduce oxygen delivery and drive up blood pH. What happens if you were to take 5 of those deep breaths? How would your head feel? You will feel lightheaded. You will feel dizzy. That's not a sign of increased blood flow to the brain. That's a sign of less. The more air you breathe. So if you're doing a breathing practice and you can hear your breathing, or if you're doing yoga and you can hear your breathing, or if your instructor is cueing you to breathe more air, don't listen. Breathe less air and see how your body responds to that. And experiment with it. Don't listen to me either. Look into the science and look into the physiology because I think that's really, really important. Anybody who's teaching breathing, it's really important that you understand the basic physiology of it. Check out the Bohr effect, BOHR. Understand how hemoglobin releases oxygen in the presence of carbon dioxide, drop to blood pH. Understand how do you dilate your blood vessels? How do you improve blood flow to the brain, or how do you decrease blood flow to the brain? So let's start anyway with this. So whenever you're ready, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and breathe normally for about 15 seconds or so. So you're only holding your breath for 5 seconds, Leo. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and breathe normally for about 15 seconds or so. So this is your emergency exercise. The next time that your airways feel a little bit tight, start doing the breath hold exercise. And if you have asthma and if you want to look into asthma, look at the Buteyko documentary that was done by the BBC back in 1998 called Breathless QED, and maybe Ruth or Owen will be able to share it. So if you have an interest in asthma, it's a really beneficial documentary to watch, half-hour documentary. The BBC commissioned it back in 1998. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and breathe normal for about 15 seconds or so. So you're just breathing normal for 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and breathe normal for 15 seconds or so. So it's a very gentle exercise. And this would be an exercise that we would use quite frequently to start off with, especially for people with panic disorder or anxiety, because you never know their relationship with their breathing. You know, so I want to give them a very gentle exercise that they feel safe and that they can make some progress, because sometimes with panic and anxiety, even just paying attention to their breathing can make them feel uncomfortable. So with this exercise, we can do it without having to pay attention to the breath. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and breathe normally for about 15 seconds. So we'll just do this 2 more times. And then what I will do is go on to the nose unblocking exercise. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and breathe normally for 15 seconds or so. So as you hold your breath, there's a gas called nitric oxide that accumulates in your nose, and then you let go, you carry that nitric oxide laden air into your lungs, and it can help to open up your airways. So if you're feeling chest issues, do this exercise. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose. Okay. Now we're going to go on to the nose unblocking exercise. But if you have panic disorder, you have to go very easy with this next exercise. And the reason being is because the air hunger, you may have an exaggerated response to air hunger. And you need to be careful not to expose yourself to too much air hunger, because that could put you into panic symptoms. But I'm going to go easy anyway, because I don't know your backgrounds. But at the same time, I want to push you a small bit so that you can experience, can you open up your nose by simply holding the breath? And if any of you have nasal obstruction, you also are more likely to have a sleep problem. And there is a study, or a couple of studies, looking at nasal obstruction and cognitive function. So cognition, planning, concentration, ability to make decisions is reduced with people with nasal obstruction. So to help decongest your nose, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and just gently nod your head up and down as you hold your breath. And do it for about 5 head nods. And then to let go, but to breathe in through your nose. And kind of just pay attention, is your nose going to, is it easier to breathe through? Is it worse? Is it the same? Now 5 head nods is not going to do a whole lot, but I'm just kind of easing you into it. And Michael, because of ME, don't overtax the system either. So go gentle. So I probably wouldn't do more than 5. The whole thing with that is that, you know, with the nervous system, you want to go nice and easy to build up the foundation, build up the engine, not to overdo it. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose. And now nod your head up and down again, holding your breath for 5 head nods. Just gently doing it for 5 head nods, and then letting go, but breathing in through your nose. And if you feel comfortable with that and you don't have serious medical conditions, we're going to increase it to about 8 head nods. So air hunger it's a primal fear. But we want to give you a controlled dose. Now, you experience air hunger all the time. Anytime you do physical exercise, you're going to feel some degree of breathless. So similar feeling. The only difference is now you're doing it sitting down. So whenever you're ready, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose. And now just gently nod your head up and down, just gently doing it for about 8 head nods, 8 head nods. And then letting go, but breathing in through your nose. Then letting go, but breathing in through your nose. Now, it is normal that one side of your nose is congested during rest. And every 90 minutes or so, give or take, they switch sides. So if your right side is congested, and you're breathing through your left, you're in more relaxation mode. But if your left side is congested and you're breathing through your right, you're more in enlivening or sympathetic mode. So it's not true that the left side of the nose activates the right hemisphere of the brain. That's not correct. But if you are breathing solely through your left nostril, it has a relaxation effect. So if you were feeling very stressed, you could also just block your right nostril and only breathe through your left nostril. You don't need to change nostrils, just only breathe through your left nostril. So let's do this one again. Take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and just gently nod your head up and down, holding your breath. So you're just gently, and this time to hold your breath for about 10 or even 12 head nods, 10 or 12 head nods. And then when you let go, but you breathe in through your nose, and then you're just breathing normal. So the key with this is, can you hold your breath? By holding your breath, can you help to decongest your nose? And we'll just do it 2 more times. And then I'm going to give you an exercise which involves breathing less air. And the reason that I'm going to focus on this exercise is because it's very often different to what you're told about breathing. We still have a belief in the Western world that the more air we breathe, the better. Absolutely, that is not true. Food is essential as well. But you know what you'd be like if you were eating food because you think it's good for you in terms of overeating. Yeah. So can we try for 15 to 20 head nods and just push it out a little bit, but not to overdo it, especially if you have underlying issues. Go easy. Yeah. Take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and just gently nod your head up and down, holding your breath. And keep relaxing into the body, but also listen to your body. So I need you to challenge yourself, but I also need you to be able to recover within 2 breaths. So you're challenging yourself and you're pushing yourself a little bit, but never to overdo it, to recover within 2 breaths. And then we will wait a half a minute and we'll just do 1 more of those. I'm interested in terms of, if you put it into the chat, is it making no difference to your nose? Is it helping your nose? Or is it your nose? Yeah. Is your nose worse? Is it the same? Or is your nose better? Naomi, oh, sorry, you're a POTS specialist. Oh, yeah, that's good. Physiotherapist. Again, we do use breathing re-education, helping to bring balance to the autonomic nervous system for long COVID and POTS, especially working to help improve respiratory muscle strength could be an important one for POTS. And then we will do it just once more. So whenever you're ready. My nose is fine, but good to have the exercise for when, yeah, even during a head cold. Now, if you have a head cold, your nose will get congested again. But at the same time, the thing about the human nose is that the more you breathe through your nose, the better it works. And the human nose has about 30 functions of the human body. The mouth does nothing for breathing. There's nothing inside the mouth that helps with your breathing, both in or out. Like breathing in through the nose and out through the mouth. Does it really make sense to be breathing out through the mouth? What does the mouth do for the breath? What's inside the mouth when it comes to breathing? What is inside your mouth? Your teeth, your tongue, your hard palate, your soft palate, the back of the throat, gums, saliva. Nothing in there for breathing. There is nothing inside the mouth that serves any purpose for breathing. Think about it, yeah? Your nose is there for breathing. Your mouth is for eating, your teeth, talking, your tongue. So drinking. Those are the functions of the mouth. So breathing is an emergency. So it's not what we should be breathing through all the time. Yes, we can breathe through the mouth, but primarily it should be the nose. So let's do the nose unblocking exercise once more. So whenever you're ready, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose. And just gently nod your head up and down. So Jane, if your left nostril is almost permanently congested, it may be a deviated septum. If this exercise doesn't help you, then it's likely it's mechanical obstruction. And that's how we know, we have children, say, for example, coming in with mouth breathing, and we want to find out, why are they breathing through an open mouth? Is it because of a stuffy nose? Is it because of enlarged adenoids? Or is it because of behavior? So is it a mouth breathing pattern that they've just developed, a behavioral issue? So we do the nose unblocking exercise and other exercise to help decongest the nose. And we know then by how comfortable the child is breathing through the nose following the exercise, what is the contributor to their mouth breathing. So you can ascertain, you know, people come in, they could say, I'm a rugby player and I have a deviated septum. Can you help me? Well, I'm not going to know by looking at anybody, but I will know when we do this exercise. Because if it's reversible nasal obstruction, we can help it and it's pretty quick. Yeah. Okay. So you can see anyway that many of you felt that your nose is opening up. And yes, it genuinely does work. I've seen it for 23 years. Does removal of the adenoids help breathing? Only if absolutely necessary, Liz. Other routes that you might do is use medication first to shrink the adenoids. Help the child to breathe through the nose. If the child is breathing through the nose, do the adenoids then shrink? Or go to an airway dentist to help expand the palate to make more room so the child can breathe through the nose. I made a mistake with my own daughter. I had her adenoids removed too soon. I regretted it afterwards. I did that, 11, 12 years ago? I shouldn't have done it. But anyway, I learned. So your adenoids do serve a function. But at the same time, if the adenoids are completely blocking breathing, causing sleep disorder breathing, well, then the adenoids are likely better at getting them removed. So you have to be careful with it too. Okay. What's the nodding up and down? I think it's just mainly a distraction. I can't think of any other way that it's, you know, it's just the way we have done it. But you could actually walk holding the breath. It will still work. You could jump up and down on one leg holding the breath. So you could do any sort of movement after holding the breath and it will still help to open up your nose. So what's the mechanism there? As you hold your breath, carbon dioxide accumulates in your lungs and blood. It's likely causing a stress response, and it's the stress response that causes the blood vessels in the nose to constrict. And that's why you feel that your nose is easier to breathe through. And because, you know, the feeling of nasal congestion is oftentimes due to inflammation. So let's breathe less air. So what I would like you to do is, if you have panic disorder, you have to go easy. You go over disordered breathing through the course. Simone, the entire course is all about functional breathing and restoring it, assessing it, and restoring functional breathing in clients, children and adults. So one hand on your chest, one hand just above your navel. And what I would like you to do is even just apply a little bit of pressure with your hands against your chest and tummy. Just a little bit of pressure, just almost to encourage your breathing to soften. And as you're doing that, what I would like you to do is to take a very soft breath in through your nose. So as you're breathing in, can you soften and slow down the speed of the air coming into your nostrils? So as you're breathing into your nose, can you breathe so softly, almost that you feel hardly any air coming into your nose? And then as you breathe out, can you bring a total feeling of relaxation to the body? So the objective here is that I would like you to breathe less air, not by holding your breath or freezing your breathing, just by softening the speed of the air coming into your nose. So can you breathe so softly, almost that you are hardly breathing any air into your nose? And then after taking that breath in, bring a total feeling of relaxation to the body and allow a relaxed and a slow and a gentle breath out. And at the same time, you're pressing with your hands just a little bit of pressure against your chest and tummy. So the whole objective here is to breathe less air. If you breathe less air, you feel that you're not getting enough air. If you feel that you're not getting enough air, it's telling you that carbon dioxide gas has increased a little in your lungs and blood. And even though you're breathing less air now, your organs are getting more blood flow. If you're breathing less air and you're feeling air hunger, you will have increased blood flow throughout your body. But you don't just have increased blood flow. You also have increased oxygen delivery throughout your body because of the Bohr effect. You're also helping to reduce brain cell excitability. And that's why I have to emphasize, in breathing world, very often the emphasis is take a full deep breath. Why not do the opposite? Because when you take the full deep breath, it's not going to have the same effect that this will have. So continue gently softening and reducing the volume of air that you're breathing for about 1 minute or so. Now, if you felt panic, of course, take a rest. or if you have involuntary contractions of the diaphragm, take a rest. So this is about breathing less air to allow carbon dioxide to accumulate in the lungs. If carbon dioxide accumulates in the lungs because you're breathing less air, it will accumulate in the blood leaving the lungs. As carbon dioxide accumulates in the blood leaving the lungs, your 50,000 miles of blood vessels dilate. You will increase blood flow to the brain by between 5 and 10%. So even though you're feeling that you're not getting enough air now, you have increased blood flow and oxygen delivery. So continue just gently softening and slowing down your breathing. Now, as you do that, pay attention to the saliva in your mouth. If you're getting stressed, your mouth can go dry. If there's no difference, well, there's no difference in the saliva in the mouth. If you're feeling relaxed, your body will produce more saliva. If you activate the digest response, you will have increased watery saliva in the mouth. But also tune in your state of mind. Do you feel sleepy or do you feel alert? How are your hands internally, not just because you have your hands against your body, but if you breathe a little bit less air, can you improve or change the temperature of your hands? Take a rest with that. Take a rest. We will come back to that again. So when you're starting off with that, it can be a little bit tricky because air hunger, even though you will experience it when you go for a walk, it's very normal. It's very natural. So all you're doing is just reducing the volume of air that you're taking into your body by about 30%. It's not just about slowing down your breathing. You could slow down your breathing and still hyperventilate. Because slowing down the breath is just the respiratory rate. But we want to look at both the respiratory rate and the tidal volume. In other words, the volume of air that you draw into your body with one breath. So never just think about breathing as how many breaths per minute. That's not enough. We have to think about how much air are you taking in with each breath. And if you slow down the respiratory rate, but if the tidal volume increases disproportionately, you could end up even breathing more air than before. So some person might say to you, well, I'm doing slow breathing, but I'm feeling lightheaded. Yes, you're slowing down your breath, but you're breathing too much air. Slowing of the breath is causing you to overbreathe. Overbreathe, you're getting rid of too much carbon dioxide. Now there's a reduction of blood flow to the brain. And even the heart. So if you do your physical exercise with your mouth closed, that's beneficial in terms of cardiovascular health. So there's a paper by George Dallam recently, and I did a podcast with him also. It's up on YouTube. So he's a sports medicine scientist, and since 2005, he has been interested in nasal breathing during exercise. And his recent paper is, he looked at endurance athletes. These are individuals who are doing a lot of miles running and cycling or whatever they do. And a lot of them are prone to cardiac fibrosing. There's fibrosis of the heart, scarring of the heart muscle. And he put it down, if these athletes switched to nasal breathing, could it reduce the risk of atrial fibrillation and cardiac fibrosing? Because if you do your physical exercise with your mouth closed, you're increasing blood flow to your heart. So when you're doing physical exercise, yes, you're working your heart harder, but are you giving your heart enough blood flow to perform the work that you need it to do? And it's a difference if you're breathing through your mouth or breathing through your nose. Okay, let's give it a go again. I'm not sure, did any of you feel air hunger, by the way, when you did that? Did you feel that you weren't getting enough air? No? Nobody? Few people, okay, that's good. So I need you to feel that you are not getting enough air. Otherwise, you're just sitting there with your hands on your chest and tummy, and that's not going to do a whole lot. So I want to see what impact does the feeling of air hunger do. So that's what we're gauging in. So you check in on your saliva in the mouth, check in on the temperature of your hands, and check in if you're feeling alert or sleepy. Now, what I'm going to have you do is take your hands away from your chest and tummy. Put your hands anywhere, on the table. They don't have to be in contact with your body. We're going to see, can we improve blood flow into your hands? So you're going to have your hands out in front of you like that. And this is just to show you the effects of changing breathing patterns. Can you improve blood flow to the hands? So the objective here is, As you're breathing in, I really need you to soften and slow down the speed of the air coming in, almost breathing hardly any air into your nose. And as you're breathing out, that you have a slow and relaxed exhalation. I need you to feel air hunger, but I don't want you to feel panicked. If you feel panicked, you take a rest and you just go back to your normal breathing. It will take you a little bit of practice to get down to the point of air hunger where you can sustain it. So how do you do that? You could take a shorter breath in through your nose. You could take a flicker of air into your nose, breathing in for 1 centimeter, breathing in for a half an inch. Or you could have a really soft breath in through your nose, almost that your breath in is imperceptible. And then as you're breathing out, you're really having a slow and relaxed exhalation. And I need you to breathe less air. So if I'm to look at your breathing, I shouldn't see so much movement. I need you to hide your breathing from me. Don't be so greedy with your breathing. So hide your breathing from me so I don't see so much movement. But don't hold your breath. Don't freeze your breathing. And Michael, don't overdo it either. But gently soften and slow down your breathing to the point that you feel air hunger. Now, air hunger is not that your oxygen has dropped, because the primary driver to breathe is not oxygen. Air hunger is that your carbon dioxide has increased a little in your lungs. And if it increases in your lungs, it will increase in the blood leaving the lungs. And if it increases in your blood, it will dilate your blood vessels. So that's what I want to see. Can you improve blood circulation to your hands? Because if you get this, this is what got me into breathing. I always had cold hands and feet and brain fog. I never realized that my slightly faster and harder breathing every minute, every hour, every day, and breathing through an open mouth during rest and exercise and sleep, I was overdoing it with my breathing. And that was causing my blood vessels to narrow. And I had that. I only came across this when I was about 26 years of age. So can we continue experimenting with this? And if you come away understanding the link between breathing less air and the biochemical dimension, and this is only one piece of it, it's a really important link for yourself. You're taking a very, very soft and slow, gentle breath in through your nose, and a relaxed and a slow and a gentle breath out. And as you're doing this, I need you to feel that you would like to take in a deeper breath. I need you to feel that you're not getting enough air. And as you do it, pay attention to the saliva in the mouth, pay attention to the temperature of your hands, and pay attention to whether it's activating a sleepy response or if it's hyperarousal, because of course, this isn't just about relaxation. Relaxation is relaxation, but air hunger can induce a stress response. But which side outweighs the other? Does the relaxation outweigh the stress, or is the psychological air hunger outweighing the relaxation? You will know by how your body responds. Check in on the saliva. Take a rest. Take a rest there. Did you have air hunger, by the way? Yeah, great. So it's not by holding your breath, and I suppose it's not by tensing up the body either. It's just kind of playing with it, just gently softening and slowing down your breathing. We have guided audios as well that could be quite useful for you. So we have a sleep hub. I don't know if it's been launched yet, but it will be coming on track. I'm just curious to see in chat, did any of you find that your mouth is going dry, or did you have increased water saliva? Oh yeah, so you're starting to notice a change there. Did anybody notice their hands getting warmer? So Dial noticed it. Hands are still cold, but the saliva is increased. Practice this as well in your own time, you know. It'll be an interesting one for you. I felt it fairly straight away. I did it for about 3 or 4 minutes. Because I think the experience of it is more important than telling you kind of, or not telling you, but going through what's kind of happening, you know. So hands are getting a little warmer. I can feel the activation, increased saliva in the mouth. So if you activate the rest response, you feel sleepy, and the digest response, you have increased water saliva. So therefore, you know that you've dampened your stress response. And the other thing about that exercise is that when you have the increased carbon dioxide, there's some effect happening with the default mode network. And the default mode network is when you're not paying attention to something and you're stuck in your head, that's when the default mode network is active. But you don't want the default mode network. You don't want it, different parts of the brain firing at all over the place, because then that's going to generate rumination. So we can learn, we can change our breathing patterns to actually reduce our thinking, to reduce rumination of the mind. And poor sleep also feeds into rumination of the mind. So that's why I would say, don't just think about mindfulness or a directed attention. Of course, that has a purpose. But what about your underlying breathing pattern? And what about your sleep? Because you could be practicing mindfulness and you might feel it's so challenging for you. Well, it can be if your physiology is just in that increased stress response. So I'm going to open it up for questions. So we have about 25 minutes. Any questions you have, I'll try and answer them for you. You can put the questions into chat, or you can unmute yourself, or maybe Ruth, because I know Ruth, you're leaving us pretty soon. If there's any questions that are there that we need to go through now.
Yeah, there was a few people were asking, do you know when you did the nose unblocking exercise, why you have to hold the nose? If you want to explain that one, a few people had asked it.
Yeah, I just think it's a little bit easier. Now, you could just hold your breath, stop breathing, but I actually think it's a little bit easier. You don't have to necessarily pinch your nose either. You could just kind of block the entry into the nose just to prevent airflow. But I just think it's a bit easier. Yeah.
Perfect.
Is there any more questions, Ruth?
Yes,
Yeah, there's a few that I can grab one from Josephine.
Yeah.
What do I do to help a 2-year-old infant boy to stop continually mouth breathing? He can be heard as it's quite loud. Just a 2-year-old, yeah.
Yeah, we're a little bit limited, Josephine. We only, in terms of breathing exercise, from 4 or 5 years of age upwards. If you could find a myofunctional therapist, it would be really good. Somebody who is specialized to identify with it. A pediatric dentist who understands about the airway as well. If you can hear the child breathing, it's not ideal. It's not to scare you or anything like that. But the fact that you've picked up on it, I think you need a professional assessment there. So it would be outside of our scheme, because we only work with children, say 4 or 5 years of age upwards. Now, the exercise for children, we have them free online, but they won't apply for a 2-year-old because of, just the child is a little bit too young. A healthcare professional who understands about airway will check little things. They might measure the width of the maxilla, the top jaw. They might check if there's a high narrow palate. They might check if there's infringement of the nasal cavity. It's worth checking out though, because you do need a child to breathe easy, and you don't want a child with a restricted airway, because that's not good. Yeah. Does a pacifier? Yes, sorry.
Yeah, the pacifier question was the one I was going to throw at you, because it's relevant.
Yes, like again, a pacifier or a dummy that we would call it. If a child is upset, an infant or a baby is upset, they're going to either put their fingers into their mouth or they're going to put something into their mouth. So you could use a pacifier, and it helps the child to calm down. Long-term use of the pacifier isn't good either. And the reason being is because if the child is sucking it, it pulls everything inwards. So it could cause a narrowing of the facial structure because of the sucking action of the pacifier. But at the same time, there's a use for the pacifier in terms of calming the child down. So, sometimes you're walking around a shopping center and you see a 5-year-old or a 4-year-old and they have the pacifier in for an hour. Like, that's not ideal, so limited use where necessary, and not overdoing it either. And ideally getting them out close. There's a book that was written about 100 years ago called Shut Your Mouth and Save Your Life. And it was written by an American painter called George Catlin. And he noticed the Native American Indians, whenever a young baby had the mouth open, the mother would press the baby's lips together to ensure nasal breathing. So it was a big part in some cultures, nose breathing. And it was probably a big part in our own culture. But now between 30 to 60% of children are breathing through an open mouth. 30 to 60%. It's absolutely huge. And 50% of adults are breathing through an open mouth during sleep. So even out of the group here, 107 people, there's likely about 50 of you waking up with a dry mouth in the morning. And you might never have thought that it was likened to, having the mouth open and breathing hard and heavy and snoring through an open mouth, etc. Yeah. Will the chronic tightness around the diaphragm and rib cage release on its own with these breathing exercises? So I would start with nose breathing, Janet. You naturally have a better recruitment of the diaphragm. And there are specific breathing techniques, though, to target breathing from a biomechanical dimension. Like I only went in, like we work with about 25 different techniques. With the Buteyko method, is about 14. So yes, but I would still start with nasal breathing, because even if you go for a walk with your mouth closed and direct your breathing low, you can still have a better recruitment of the diaphragm, which can help to free up the diaphragm. And you do want free movement of the diaphragm. Now, physiotherapists too have different tools in terms of helping to massage the diaphragm or helping with a diaphragm release. But at the same time, if you want to improve breathing from a biomechanical point of view, you have to think of what's causing the upper chest breathing in the first place. Could it be that the person is feeling too much of air hunger? Could it be that the person is mouth breathing? Because if we feel that we're not getting enough air, we kind of revert to upper chest breathing to alleviate the sensation of air hunger. But the feeling of air hunger or not getting enough air is not necessarily a biomechanical issue. That can be a biochemical issue. And so that's why I would say, like, you know, you might be a client going to, say, a physio or going to a Pilates instructor, and you might be going in with your mouth open, and you might be going in with poor breathing from a biochemical point of view. But if the physio is only targeting breathing from a biomechanical point of view, is the physio going to get a long-term result with that client? And I'm just putting it out there. I would say not, because I don't think any of us are going to get good recruitment of the diaphragm unless we switch to nasal breathing, and also unless we look at the biochemical dimension as well. If that's causing, if the upper chest breathing is caused by feeling air shortage, yeah. When doing this reduced breathing exercise, if I wear a pulse oximeter, the score should go up. No, Corinne, it won't. It won't have much of a change. But if you're doing reduced volume breathing, carbon dioxide increases in your blood. That in turn drops blood pH. And hemoglobin then will release oxygen more readily to your tissues. And as hemoglobin is releasing oxygen from the blood to your tissues, you'll see that the pulse oximeter, your blood oxygen saturation will drop a little bit. But that's not a bad thing, because it's not always just about the oxygen in the blood. You always have to think also, how can I get that oxygen from the blood to the tissues? And carbon dioxide will cause a slight drop in your pulse oximeter, but that would be normal and that would be expected. How important is it to...
wondering,
sorry, thank you, Owen.
Patrick. Marilu, sorry for the pronunciation of your name. How dysfunctional breathing relates to acid reflux?
Somebody with acid reflux, I'd probably be thinking more about sleep and thinking, does that person, are they stopping breathing during sleep, or could there be a connection in terms of the diaphragm sucking the acid from the stomach? So somebody with acid reflux, I would be asking, how is that person breathing during sleep? Yeah, there could be other factors there as well. That's a bit outside my scope, but I would still put that question out there. Look at sleep as well, you know.
Coffee was also wondering and I'd personally like you to keep this brief because I know you could probably speak quite in depth on it. It's just curious between Buteyko and how it compares to Wim Hof.
Oh, Wim Hof is a hyperventilation and long breath hold exercise. It's not going to change your underlying breathing pattern. So when people do the Wim Hof method, they do feel oftentimes euphoria. They feel very good from it. But where Buteyko comes in is that it's looking at how is the person breathing every minute, every hour, every day. And it wants to improve the foundational breathing, their everyday breathing pattern. And I think it's a big one. I think it's a really important one. Now, the other thing about Buteyko, it's very accessible. Pat Pine, I think I know Pat Pine's name. Maybe not, but I think I do. The Buteyko technique is very accessible because you can integrate it into your normal everyday life. So you don't actually have to really, you know, at the start, you can set time aside, of course, to learn anything. But the whole objective here is bring it into your way of life. You know, how are you breathing when you're walking? How are you breathing when you're sleeping? And like, to go a little bit deeper into it, if you read one of my books in terms of the new sleep book, I think is going to be a pretty good one in terms of the application of it for sleep, just to get an insight into it, you know, what I can do. So yeah, Wim Hof is a stressor exercise, and Buteyko We do have stressor exercise in Buteyko, but we don't do hyperventilation. We do normal breathing, but we do long breath holds too to help open up airways. So it's different. Wim Hof is one exercise, and with Buteyko is about 14. So it's more of an everyday. And the other thing about Buteyko, it's suitable for children right up to somebody who's quite elderly. And it's somebody with long COVID, with very poor regulation of the autonomic nervous system, to an athlete. So that's the thing, you know, Wim Hof method, I wouldn't practice it with people over 60 years of age. I definitely wouldn't practice it with people with cardiovascular issues or epilepsy or any serious medical conditions either. It's pretty tough. It's a tough technique. And I'd also wear a pulse oximeter so that blood oxygen saturation doesn't go below 60%. Because with the Wim Hof method and the hyperventilation and breath holds, you can hold your breath and overdo it. And people do, you know. So there's a point at which a good stress becomes a bad stress. So it's a very good technique, but understand technique as well, yeah.
You kind of touched on it there, Patrick. Brenda was wondering about, does the training go into depth about how these lessons are taught to children? I suppose both
yeah, totally, yeah.
Online and in person.
Oh, totally. We have a Buteyko manual, which gives a format of what to teach on day 1, day 2, day 3, day 4 for children for different conditions, including, say, for example, long COVID, etc. So it really is, it's very important to tailor it. I was working a lot with asthma at the start, and then with sleep issues, and then I started working with panic disorder and anxiety, and it was a totally different ballgame. And I overdid it with some of the panic disorder people coming in. And then what I had to do is kind of calibrate and just think to myself, I need to absolutely change how I'm teaching the exercise to this group, because they were so vulnerable in terms of their breathing. They often had a very strong fear response to air hunger, which I didn't see in the asthma group. And you could argue that you would expect it in the asthma group. It wasn't there to the same extent at all. So it's very important, you know, that you tailor it. Because ultimately what we want to do is we want to give exactly the right dose and duration and the right exercise for that client. And that's the thing about Buteyko. You can. I'm just scrolling down. Is there anybody else? Owen?
There is.
I know one lady. Sorry, Owen, yeah?
Cindy was wondering, does it also help with people with depression?
I would really emphasize the importance of looking at sleep with people with depression and obstructive sleep apnea. And I've written a scientific paper looking at breathing re-education to the phenotypes of obstructive sleep apnea. Obstructive sleep apnea is very high in people with depression. Now, you might ask the question, is it depression which is causing sleep apnea, or is it the obstructive sleep apnea which is having such an impact on that person which is causing depression, or could it be both? So whenever somebody is talking about depression, I do want to improve blood flow to the brain. I do want to be able to target the default mode network. I do want to be able to target their sleep. I do want to be able to bring balance to the autonomic nervous system. And I think all of that can help that person with depression. Yeah. So it's not going to be a cure, but you're targeting things that are very specific to that, you know. And I would have written about mental health in, say, the book, The Breathing Cure, which will give you some insight into it.
Simona was wondering why are physios not doing this training?
It's just, well, physios, quite a few physios do our training. They do attend our training, but this training isn't taught in universities. Physios have their toolbox. But as far as I'm aware, hypoventilation is not part of what a physio will teach. Nasal breathing, nose unblocking exercise, they're all from the Buteyko technique. So it's just a different modality. So, but we have quite a few physios. Physios in the UK, for example, in the NHS are allowed, in terms of if you put in Buteyko and NHS, it is part of the training, or not part of the training, but physios can bring the Buteyko technique in, especially when they're working with people with respiratory complaints. So yeah, it is taught, but it's not physio.
Nadia was wondering how she would measure CO2 in her body.
Well, the normal way to do it, well, your control pause that we measured earlier on is an indirect measurement of your chemosensitivity to carbon dioxide. And if your control pause is less than 20-25 seconds, it would indicate that your breathing is has room for improvement. With people with long COVID, we have seen controlled pause of 3 and 4 seconds. These people, their breathing was so poor that they could hardly string a sentence together. But to answer your question, the only way to really kind of determine CO2 in the lungs, which will give you a good approximation of the CO2 in the blood, is using capnometry. So this is when the individual breathes into a chamber and the chamber is able to take the carbon dioxide from the end part of their breath, because this is the gas coming from the small air sacs in the lungs. So capnotrainer or capnometry is how you measure CO2.
Rachel was wondering what can be done for people who have protruding teeth, which makes it difficult to fully close their mouths. They think that their mouth is fully closed, but there's a slit still open. Is this something that can be worked
This is
on?
where myofunctional therapy would be very, very important. So it may not be necessarily that the person has protruding teeth. So sometimes you'd have to ask the question, is their lower jaw a bit set back? But myofunctional therapy, especially aligned with a dentist who understands about airway, would be the best approach there. There are different techniques that they can use, putting a button in behind the lips, button pulls, and different orofacial exercises to really help with that. So I'd reach out to a myofunctional therapist for that question.
Cindy was wondering how long you should be able to do the controlled pause.
Well, a great target, Cindy, is 40 seconds. For the vast majority of people, our objective is to get them up to 25 seconds. Now, bear in mind, you should have normal breathing at the end of it. And it was put to a test, actually. A professor of physical therapy, Kyle Kiesel, he did a study of 51 individuals. So I'm just kind of pulling up the paper now. And his conclusion was that if your controlled pause is less than 25 seconds, your breathing is dysfunctional. Or if your controlled pause is above 25 seconds, there's an 89% chance that your breathing is functional. So he was talking about healthcare professionals, a development of a screening protocol. Now, the screening protocol that he used is actually the controlled pause from the Buteyko technique, and it's called that. So the breath hold time of 25 seconds. Now, the 4 questions you don't really need them. Do you wake up with a dry mouth? Do you feel tense? Do you have cold hands and feet? Do you yawn frequently? They're just common symptoms of poor breathing. But basically, if your controlled pause is greater than 25 seconds, there's an 89% chance that your breathing is functional. And like his conclusion was that healthcare professionals need to be able to screen for the presence of dysfunctional disorder breathing. And it's an interesting paper, and you'll find this anyway online. So dysfunctional breathing is commonly occurring in the general population, estimated as high as 50 to 80% of adults have some level. So it's linked to lower back pain, neck pain, anxiety, depression. 50% of individuals with lower back pain, 83% of individuals with anxiety demonstrate some form of dysfunctional breathing. And that's why it's very important to look at all 3 dimensions. Don't just focus on the biomechanical. It's not just about the diaphragm. The diaphragm is one dimension. And of course, the diaphragm is important for the core muscle dysfunction, the core. So subjects with dysfunctional breathing have been shown to demonstrate concurrent core dysfunction, including altered postural responses during limb movements and altered inner core muscle activation. Further, normal breathing has been described as forming the foundation for all movement patterns. So if breathing is abnormal, movement is abnormal, and if movement is not normal, the person is more at risk of injury. So yeah, there's plenty of papers out there on it. I would have referenced that in the books, and there's other papers as well.
Colin is wondering, does muscle mass have a large impact on CO2 tolerance? Like more muscles
Yes, it does.
muscle equals more oxygen, burn faster, thus a lower control.
Yeah, and a higher metabolism. So say you have a guy or a girl who comes in and they're really, they're a bodybuilder, their breath hold time tends to be lower. So we do see that. So yes, it does. It has an impact on it.
There's a couple of people wondering about the difference between Oxygen Advantage and the Buteyko training.
Yeah, it's really, Oxygen Advantage was created for performance. So say, for example, corporates, athletes, And you'll kind of know by the instructors. So if you go in an Oxygen Advantage and you look at our instructors, you'll see that very often they're performance-based. They're in the sports and fitness world, and they're in the corporate world. They're also in yoga, because a lot of like yoga isn't necessarily, even though it's health focused, but people don't go to yoga. A lot of healthy people do yoga. So Oxygen Advantage is more focused on performance and fitness, whereas Buteyko is focused on specific conditions, mental health, respiratory health, sleep health, and then working with children. So that's the main difference. The Oxygen Advantage would have a wider range of exercises, but Buteyko then is very specific. So there's differences and some overlap, but differences too. So it depends as well, sorry Tone, but it would really depend on the client that you're working with. If you're working in the fitness industry, I would absolutely say go with Oxygen Advantage. If you want to give a talk to corporate environment, that's Oxygen Advantage. If you're a yoga instructor, I would go with Oxygen Advantage. But if you're working in mental health or sleep or respiratory or working with children and teenagers, I would go with Buteyko.
Great. Josephine was wondering in relation to the exercises you were just performing, should the gentle breathing for air hunger go very deep, or can it be more shallow?
It doesn't really matter, because the focus with that exercise is to just create air hunger. Now, you could focus on breathing light and low at the same time, but that would take a bit of practice. And, you know, starting off, it might be just a bit too confusing. So, of course, we want to achieve good recruitment of the diaphragm, but during that practice, the emphasis is on targeting primarily the biochemical dimension of breathing. So when people ask me during the practice, should I be breathing with good recruitment of the diaphragm or not, I said, don't worry about that. Only focus on breathing less air. That's the focus of that exercise. But we do also give other exercises then to improve the biomechanical dimension of breathing.
And we had someone else wondering, how do these exercises change focus for pregnancy and labor?
Oh, during pregnancy, we don't encourage the application of any breathing exercise, especially during first trimester. We would encourage the mother to breathe in and out through her nose and do relaxation. During labor, I would emphasize or encourage you to do your own research on it. Look at carbon dioxide and smooth muscle in the uterus and ask yourself the question, does it make sense for the mother during labor to take full big breaths, which in turn is going to blow off carbon dioxide, which is going to cause everything to constrict? You know, taking the full deep breaths, I would encourage the mother do her research on that. You know, look at the impact of carbon dioxide, smooth muscle. You don't want everything tightening up and for the baby to try and pass through a tight channel. If the mother was, I would say for her just to breathe as normal, the way she feels her body needs to breathe at that time. But I definitely wouldn't take exaggerated breaths, because the exaggerated breaths could cause hyperventilation, and it doesn't make sense to elicit an increased stress response on top of already giving labor. And I think that does happen during labor, but that's why I would say do your research on that as well.
Right. Liz is wondering about, she says she's often asked about yawning and if it's good or bad and why they do it.
Yeah, we don't know. I'm sure there's different reasons of it. I've heard different reasons over the years. I really don't know myself. Yawning and sighing is a frequent feature with people with dysfunctional breathing. You know, is it due to poor sleep quality? Is it due to something else? So I don't know. It's a good question.
Janet's wondering, have you worked with someone who is on oxygen 24/7?
Yeah, of course, people with COPD. You know, we can have limited results if the airway obstruction is really irreversible. So typically with chronic obstructive airways disease, 50% of people will have some degree of reversible airway obstruction, meaning that their airways are not permanently damaged. Their airways are narrowed, but we can help to open them up. With that group of individuals, yes, we can help to get some degree of bronchodilation, and we can help with their breathing and reduce breathlessness. But if a person, say, for example, is on oxygen 24/7, it's likely that, you know, they're at the more severe spectrum when it comes to COPD. It's going to be limited.
Yep. Would you ever advise hyperbaric chamber?
Yeah, I've heard very good things about hyperbaric. We've used them ourselves. They make sense in terms of the increased pressure of the atmosphere that's able to drive oxygen, at a higher concentration into the lungs, which in turn is going to increase oxygen dissolved in the blood, which will allow better diffusion of oxygen from the blood to the tissue. So absolutely, they have their role. So I've heard very positive things about hyperbaric chamber. And I would also say is improve your underlying breathing patterns as well,
Corinne, and apologies, Corinne, I missed this earlier because I know you asked earlier. When you're speaking, example, leading a workshop or training like this for a significant length of time, how do you nasal breathe? Seems like you'd
I
have to
don't.
mouth breathe in that situation.
I don't, because if I was to take a breath through the nose every time, it would totally disrupt the cadence of the talk. Like I can do it now. I'm going to talk, but now I'm going to stop to take a breath through my nose. And now I talk again. So the gap would be too long. You could do it, but I don't know. I really think it would kind of disrupt the cadence. I've got one rule of thumb when I'm talking. I don't want to hear my breathing. But talking is tiring. Any of you who talk for a living, you might notice at the end of the day talking that you're exhausted. So then you have to ask the question, what is the talking doing to your breathing? Talking causes hyperventilation. Hyperventilation brings on fatigue.
And we might just wrap it up here with this last question. What would you
Sure.
do with someone who has COPD and aneurysm?
Oh God, we're very limited there. It's really about going so gentle and no claims whatsoever. With the aneurysm, I would be very hesitant. I wouldn't teach any breathing exercise. The only thing there that I would do is, well, of course, that's under the care of a medical doctor. But relaxation could be helpful. And I wouldn't see that relaxation would cause any harm. Nasal breathing, once it's not forced, could be helpful. And again, it wouldn't cause any harm. But it would be limited in that instance. And of course, that's under the care of a medical doctor.
I might just ask you to give very quickly, Patrick, on the in-person and online certifications, just to give a brief overview of the additional information that people would get from doing the courses.
Yeah, the main difference, like face-to-face is always better. That's just the way it is. It's 4 days of training. It's a deep dive into both the practical and the theoretical. So we work from 9:30 until about 5 o'clock with a group of people, and there's a good sharing of information. And it's more of an experience as well because it's held here at our centre in Galway in Ireland. Whereas the online, I give the 7 by 2 hour sessions. So we cover it that way. And we also, in both trainings, whether it's face-to-face or online, we also have a monthly meeting. So we meet up for a refresher. And typically I don't have a topic to cover. Sometimes I do with the monthly refreshers, but normally the monthly refreshers are an opportunity for instructors to be able to ask me questions. So they collect their questions and then we meet up and then we go through different answers there. The training portal is pretty good, because we put a lot of work into it. We spent about a year revising all of the material over the last 23 years, and we created new PowerPoints, new videos. So everything is there and you have access to that all the time. So, if somebody was signing up, you get instant access to the training portal. You could start straight away. So the training portal is a great support then for the online by Zoom, which is 7 by 2 hour. It's a very similar scenario here by Zoom. Yeah. So you're kind of getting a taste of the online training right now. And then the face-to-face then is the whole experience around the face-to-face. Yeah.
That's great, Patrick. Thanks.
Great.
We'll probably wrap up there. That's fantastic. We will send out obviously the live by email probably tomorrow morning at this point. And thanks everyone for attending. And obviously all information is available on our website to do it in-person trainings and our online certifications.
Great. Thank you very much, everybody. Thank you, Owen. And breathe through your nose and don't forget to breathe light. Thanks very much, everybody. Take care. Bye.